As we get older, our bodies go through a lot of changes, and one area that often goes unnoticed is how we respond to medications. It's not just about feeling older or moving slower. Your body may absorb, process, and remove medicines differently than it did in your younger years. For example, your digestive system might not absorb medications as efficiently, while your liver and kidneys may take a little longer to process and filter drugs from your body. These changes can affect how well medications work and how long they stay in your system. On top of that, many adults over 60 take multiple medications to manage conditions like high blood pressure, diabetes, arthritis, or heart issues. This combination of medications, along with natural changes in the body, can sometimes increase the risk of side effects or interactions. In this video, we'll take a closer look at 5 types of medications that seniors should use cautiously, along with safer alternatives and lifestyle strategies to help maintain health, comfort, and independence. The goal isn't to scare you, it's about staying informed, making smart choices, and taking care of your body as it changes over time. NSAIDs. Pain relief. With awareness. Next, we have non-steroidal anti-inflammatory drugs, or NSAIDs, which include medications like ibuprofen, naproxen, and indomethacin. These drugs are widely used to reduce pain, inflammation, or fever, and they can be very effective for conditions like arthritis, joint pain, or minor injuries. For older adults, however, NSAIDs require careful use. One major concern is that they can interact with other medications, including blood thinners like warfarin or Plavix, as well as diabetes and blood pressure medications. This can reduce the effectiveness of your treatments or even increase the risk of complications. Additionally, regular or long-term use of NSAIDs has been linked to stomach irritation, bleeding, and kidney problems, which can be more pronounced in seniors. If you rely on NSAIDs for pain relief, there are safer alternatives to consider. Topical NSAID gels, such as diclofenac, can target localized pain with minimal absorption into the bloodstream. In some cases, doctors may recommend protective medications like omeprazole if oral NSAIDs are necessary, which helps reduce the risk of stomach irritation. Lifestyle strategies such as gentle stretching, strengthening exercises, and maintaining a healthy weight can also help reduce pain naturally over time. It's important to understand that not all NSAIDs are equally risky. Occasional use may be acceptable for many seniors, but long-term or frequent use should always be discussed with a healthcare provider. By combining medication with lifestyle adjustments, seniors can maintain mobility and comfort safely. Muscle relaxers. Comfort with caution. Let's start with muscle relaxers, such as cyclobenzaprine and methocarbamol. These medications are commonly prescribed to reduce muscle tension, spasms, or stiffness. At first glance, they seem perfect, relieving discomfort and helping you feel more comfortable, especially if you're dealing with chronic aches or pain from conditions like arthritis or back strain. However, for older adults, muscle relaxers may cause side effects that are important to consider. Dizziness and confusion are common issues, which can increase the risk of falls, a serious concern at any age, but especially for seniors. Falls can lead to injuries such as broken bones, sprains, or even long-term complications that affect mobility. Additionally, muscle relaxers may contribute to constipation or difficulties with urination, which are already common challenges as we age. The good news is that there are safer ways to manage muscle discomfort. Gentle stretching routines, yoga, or low-impact exercises like walking or swimming can improve flexibility, reduce tension, and support overall health without the risks associated with muscle relaxers. If medication is still necessary, doctors may recommend options like baclofen or tizanidine, which are generally considered safer for older adults while still providing relief from muscle tightness. It's also helpful to combine medication with lifestyle strategies. Applying heat or cold packs, staying hydrated, and maintaining good posture can all support muscle health. Over time, these habits can reduce the reliance on muscle relaxers while improving overall mobility and comfort. Benadryl, diphenhydramine, hidden risks. Benadryl, or diphenhydramine, is a common over-the-counter medication used for allergies, itching, or even occasional sleep. While it's effective, older adults should be aware that it can stay in the system longer, leading to drowsiness, mild confusion, and balance issues. These side effects can increase the risk of falls or make daily activities more challenging. Other effects may include dry mouth, blurry vision, or constipation. One of the tricky aspects of diphenhydramine is that it can be hidden in combination medications, such as Advil PM or Tylenol PM. This means seniors may unknowingly consume it along with other drugs, increasing the potential for side effects. Reading labels carefully and consulting a healthcare provider before taking any over-the-counter medication is a simple but effective way to reduce risk. For many older adults, alternatives such as loratadine or cetirizine for allergies or lifestyle approaches for mild sleep difficulties can provide relief without the same level of side effects. Awareness and careful selection are key to maintaining safety while still managing symptoms effectively. Long-acting sulfonylureas. Blood sugar management with care. Long-acting sulfonylureas, including glipizide and glimepiride, are commonly prescribed for type 2 diabetes. These medications help the body produce more insulin to control blood sugar levels, which is important for preventing complications such as nerve damage, kidney disease, and vision problems. However, in older adults, long-acting sulfonylureas may sometimes lower blood sugar too much, leading to hypoglycemia. This can cause shakiness, lightheadedness, fatigue, or even fainting. Monitoring blood sugar levels closely and working with a healthcare provider to adjust doses or explore alternatives is essential for safety. Lifestyle strategies, including balanced meals, regular exercise, and monitoring carbohydrate intake, can complement medication and help maintain steady blood sugar levels. In some cases, shorter-acting diabetes medications may be preferred for seniors to reduce the risk of low blood sugar. Sleeping pills. Rest without risk. Getting enough sleep is essential for health at any age, and older adults often struggle with insomnia or disrupted sleep. Medications like zolpidem, azopiclone, and Lunesta are commonly prescribed to help with sleep, and they can be effective for short-term use. However, for seniors, sleeping pills can sometimes cause side effects such as dizziness, confusion, memory issues, or even increased risk of falls. These effects can interfere with daily life and reduce overall safety and independence. Instead of relying solely on medications, many older adults find that lifestyle strategies improve sleep naturally. Establishing a consistent bedtime routine, staying active during the day, limiting caffeine, and reducing screen time before bed can all make a noticeable difference. Relaxing activities such as reading, listening to calming music, or gentle stretching before bed can also promote better sleep. For those who still need additional support, doctors may suggest alternatives like trazodone or natural supplements such as ashwagandha, which have a lower risk of side effects in older adults. By combining good sleep habits with careful medication use, seniors can achieve restorative rest without unnecessary risks. Sleep is critical for mental clarity, physical health, and overall quality of life, so it's worth investing time in safe, effective strategies. Other medications to keep in mind. In addition to the medications we've covered, there are several others that seniors should approach with caution. Benzodiazepines, such as Xanax or diazepam, can cause drowsiness, confusion, or dependence. Tricyclic antidepressants like amitriptyline may affect heart rhythm, cause dry mouth, and increase the risk of falls. Alpha blockers, often prescribed for blood pressure or prostate issues, can lead to dizziness or lightheadedness. The overarching principle is to stay informed, communicate openly with healthcare providers, and review medications regularly. Never adjust or stop medications on your own. Doing so can lead to complications. Instead, focus on safe alternatives, lifestyle adjustments, and proactive care. Taking care of your body as you age isn't just about avoiding risks, it's about making thoughtful, informed choices that support your health, comfort, and independence. By understanding how medications affect your body exploring safer alternatives, and embracing healthy routines like gentle exercise, proper sleep, and balanced nutrition, seniors can live life on their terms. Regular check-ins with healthcare providers, reading medication labels carefully, and maintaining awareness of side effects are simple steps that can have a major impact. Your health is your most valuable asset, and small choices today can create lasting benefits for tomorrow. With knowledge, caution, and proactive care, seniors can enjoy a vibrant, independent life while minimizing the risks associated with medications. Stay informed, stay safe, and give your body the thoughtful care it deserves. You deserve to feel your best every single day.